Queensland, Australia is facing a serious health concern. A disease called Melioidosis is spreading and it's proving deadly. This bacterial infection is causing alarm among health officials and residents alike. This outbreak is particularly concerning in the northern parts of the state, where the environment is most conducive to the bacteria's growth. Health officials are working tirelessly to understand and control the situation. They are conducting meetings, field studies, and public awareness campaigns. It's crucial for residents to be aware of the risks and take necessary precautions. Public health notices are being distributed, and community discussions are being held to inform everyone. Melioidosis might not be a familiar term to everyone, but its impact is very real. It's caused by a bacteria found in soil and water. This bacteria, Burkholderia pseudomeli, can enter the body through cuts or abrasions, inhalation or ingestion. The bacteria thrives in tropical climates, especially after heavy rains. These conditions create the perfect breeding ground for the bacteria. This makes Queensland's recent weather patterns a significant factor in the outbreak. The heavy rains and subsequent flooding have exacerbated the spread of the bacteria. The disease can manifest in various ways, making it difficult to diagnose. Symptoms can range from mild to severe, often mimicking other illnesses. Some people experience mild symptoms like fever or cough, which can easily be mistaken for a common cold or flu. Others develop severe pneumonia or blood infections, which require immediate medical attention and can be life-threatening. Unfortunately, melioidosis can be fatal, especially if not treated promptly. Rapid response and early diagnosis are critical in saving lives. This essay will delve into the details of the outbreak, explore its causes, and provide crucial information for staying safe. We'll look at the scientific efforts to combat the disease and the steps you can take to protect yourself. Knowledge and awareness are our best defenses in combating this disease. Stay informed, stay safe, and together we can overcome this growing threat. The numbers paint a sobering picture of the situation in North Queensland. The region, known for its stunning landscapes and vibrant communities, is now grappling with a serious health crisis. Cairns, a popular tourist destination, has been hit particularly hard. The bustling streets and scenic waterfronts now carry an air of caution. Since the beginning of 2025, the city has recorded 53 confirmed cases of melioidosis. This bacterial infection, often contracted through soil and water, has taken a toll on the community. Tragically, 9 of these cases have resulted in death. Families are mourning, and the community is in shock. Townsville, another major city in the region, is also grappling with the outbreak. The city's vibrant life has been overshadowed by the rising number of cases. Since January 1, 2025, there have been 34 reported cases in Townsville. The healthcare system is under immense pressure. 3 of these cases have proven fatal. The loss of life is a stark reminder of the disease's severity. The combined death toll for both cities stands at a concerning 12. This figure is a grim testament to the impact of melioidosis on North Queensland. These numbers highlight the severity of the situation and emphasize the need for urgent action. Public health measures are being ramped up to contain the spread. The rising death toll underscores the importance of understanding the disease, its transmission, and crucially, how to prevent it. Education and awareness are key components in the fight against melioidosis. These figures represent only the confirmed cases. The actual number of infections could be higher, as many people may not show symptoms immediately. It's possible that more people are infected without knowing it, as symptoms can be subtle in the early stages. Early detection and treatment are crucial to prevent further fatalities. Within Cairns, the outbreak has been most pronounced in the southern corridor. This area includes suburbs like Manoora, Manoondah, and Edmonton, which have reported a high concentration of cases. However, recent reports indicate that cases are also emerging in central Cairns, suggesting a possible spread of the bacteria. In Townsville, specific areas with a high concentration of cases haven't been publicly identified. However, given the nature of the bacteria, it's likely that areas with damp soil and water sources are at a higher risk. Health authorities are closely monitoring the situation to track the spread of the bacteria. Understanding the geographical distribution of cases is crucial for implementing targeted prevention and control measures. While anyone can contract melioidosis, certain groups are more susceptible to severe illness. Older adults, especially those with underlying health conditions, are particularly vulnerable. Their immune systems may not be robust enough to effectively fight off the bacteria. People with compromised immune systems face a higher risk of developing severe complications. This includes individuals undergoing cancer treatment, those with diabetes, and people who consume alcohol excessively. These individuals need to be extra cautious, especially during the current outbreak. Surprisingly, cases have also been reported in younger individuals who don't fall into the high-risk categories. This highlights the unpredictable nature of the disease and reinforces the importance of taking preventative measures, regardless of age or health status. Section 5. Transmission explained. How does melioidosis spread? Understanding how melioidosis spreads is crucial for effective prevention. The bacteria primarily reside in soil and water, particularly in areas with high rainfall. During heavy downpours, the bacteria can become aerosolized, suspended in tiny water droplets in the air. Inhaling these droplets can lead to infection. Direct contact with contaminated water or soil is another significant route of transmission. This is especially concerning for individuals with open wounds or cuts. The bacteria can enter the bloodstream through even small abrasions, leading to infection. While less common, transmission through contaminated objects is also possible. Gardening tools, footwear, and even vehicles can carry the bacteria. It's essential to clean and disinfect these items regularly, especially after they've come into contact with soil or water. Section 6. The rain connection unraveling the outbreak's origins. The recent surge in melioidosis cases in North Queensland is likely linked to the region's weather patterns. The previous wet season brought significantly higher than average rainfall to the area. This excessive rainfall created ideal conditions for the bacteria to thrive. The heavy rain saturated the soil, increasing the concentration of the bacteria. The warm, humid weather further fueled bacterial growth, leading to a higher presence of the pathogen in the environment. This perfect storm of environmental factors created a breeding ground for the bacteria, contributing to the current outbreak. As climate change continues to impact weather patterns, we can expect to see more intense and frequent rainfall events in the future. This could lead to more frequent and severe outbreaks of melioidosis. Section 7. Protecting yourself. Practical steps for prevention. Preventing melioidosis involves minimizing exposure to the bacteria. During heavy rain, it's best to stay indoors as much as possible. If you must venture outside, wear protective clothing including boots and gloves to minimize skin exposure to potentially contaminated water and mud. Avoid contact with soil as much as possible, especially if you have open wounds or cuts. If you work with soil, wear gloves and boots, and wash your hands thoroughly after any contact. Children should be discouraged from playing in muddy areas, especially after heavy rain. When using high-pressure water hoses, wear a mask to avoid inhaling aerosolized water particles. The force of the water can easily disperse the bacteria into the air, increasing the risk of inhalation. Consider using a lower pressure setting or opting for alternative cleaning methods. Section 8. Recognizing the signs. When to seek medical attention. Melioidosis can be challenging to diagnose because its symptoms often mimic other common illnesses. This bacterial infection caused by Burkholderia pseudomallei can present itself in various ways, making it tricky for both patients and healthcare providers to identify. The time between exposure to the bacteria and the onset of symptoms can range from a few days to several weeks, making it difficult to pinpoint the cause. This variability in the incubation period adds another layer of complexity to the diagnosis. Common symptoms include fever, chills, cough, chest pain, and shortness of breath. These symptoms can often be mistaken for other respiratory illnesses, such as pneumonia or bronchitis. Some people also experience headaches, muscle aches, and skin sores. These additional symptoms can further complicate the clinical picture, making it essential to consider melioidosis in the differential diagnosis. If you experience any of these symptoms, especially after potential exposure to contaminated water or soil, seek medical attention immediately. Early intervention can be life-saving and prevent the infection from becoming more severe. Early diagnosis and treatment are crucial for improving outcomes in melioidosis cases. Timely medical care can significantly reduce the risk of complications and improve the chances of a full recovery. Inform your doctor about any recent travel to areas with known cases or any activities that may have exposed you to the bacteria. This information can be vital in guiding the diagnostic process and ensuring appropriate treatment. Prompt medical attention can make a significant difference in managing the infection and preventing severe complications. Don't hesitate to seek help if you suspect you might be at risk. Section 9. Conclusion: staying vigilant in the face of melioidosis. The current melioidosis outbreak in North Queensland is a stark reminder of the health risks posed by this potentially deadly bacteria. The rising death toll and the unpredictable nature of the disease underscore the need for awareness, prevention, and prompt medical attention. By understanding the routes of transmission and taking practical steps to minimize exposure, we can significantly reduce our risk of contracting this serious illness. Staying informed about the latest developments, heeding the advice of health authorities, and seeking medical help when needed are crucial for protecting ourselves and our communities. Remember, knowledge is our best defense. By staying vigilant and taking appropriate precautions, we can navigate this outbreak and minimize the impact of melioidosis on our lives.